Hello, hello. I'm here with my friend, nurse practitioner Luce Solari-Suprena. Thank you for your time. Thank you for coming and talking to me. We're going to be talking today about being ER nurse practitioner. So to start, Luce, if you can introduce yourself and tell me a little about your nursing career and nurse practitioner career. How did you become a nurse practitioner?
Hi, good afternoon, Naja. Thank you for having me. My name is Luce Solari-Suprena. I have been a nurse practitioner, a family nurse practitioner, that is, since 2013. And I've been in the nursing field since, I want to say since 2006, but I've been an RN since 2008. And from there, progressed to being a nurse practitioner.
Wow, that's how many years are you total in nursing?
2006 to 2021, I don't know, 15
What, 15? That's love. You see, that's love. That's when you love what you
years, yes.
that's when you love what you do. So, can you tell me a little bit more about your experience as an emergency room NP and how do you become one?
Well, it was when I graduated as a family nurse practitioner. So prior to working as a nurse practitioner in the ER setting, I've done quite a few other jobs slash roles slash positions. I've worked as a family practitioner in an office. I've worked in nursing home covering a physician as a nurse practitioner. I've done house calls, insurance assessment, so that's home assessment, and then the ER nurse practitioner. I was a ER nurse at first, and I got the job as an ER nurse practitioner, but as an admitting ER nurse practitioner.
Mm-hmm.
So I was there with the doctor in the ER, kind of follow the patient up until they get admitted. Initially, I was not there to treat. I was just there to do the admission. Like, assess the patient, this is what's going on. We're gonna admit, let's say, chest pain, and I'll do the orders and coordinate that with the admitting physician. So get, things done a little faster.
Mm-hmm.
But with time, I found myself actually treating the patient while they're in the ER, make the decision to get them admitted, and then get them admitted. So that developed into a full-blown ER nurse practitioner. And I was doing it on both sides of the ER, meaning I was doing it with fast track. You'll have like someone with an abscess that came in, ended up being complicated and needed to be admitted. And you'll have someone that comes straight from the back, like we call it, with a chest pain, cardiac MI that needed to be admitted. So that's how I got into it.
So from the back, meaning they've been brought by rescue, right?
But by rescue, yeah, by rescue. And then they ended up getting admitted. And from there, I transitioned fully into doing only ER. So I was working at Jackson North at first, and I left and went to Aventura and do ER, 100% ER, which was a little bit challenging.
That was a lot of information, a lot of things to.
Yeah, it was really challenging. It was a little different because all my coworkers had different backgrounds. I had PAs, residents, which we didn't have at my previous job, medical students, and nurse practitioners that were either acute care nurse practitioner or family nurse practitioner or adult nurse practitioners. So that was a little bit, a little bit challenging because everybody was, had their own belief on how to do things, on how they know how to do things, and sometimes I don't want to say butt heads, but kind of like,
But have
the patient got taken care of. So that's all that matters. So that was a little bit of a challenge. So
that's true. So you mentioned that there were acute care nurse practitioners, and you yourself is a family nurse practitioner. Do you have to be an acute care nurse practitioner to be working in an ER or to be seeking a position in the ER?
So that's a very interesting question because acute care practitioners mainly, from what I understand, are for ICU settings, not so much emergency medicine setting, because when they do transfer in the emergency medicine settings, they are kind of limited because they're not allowed to see pediatrics.
Mm-hmm.
But as a family nurse practitioner, you see everyone. But it's experience plus all the other conference that you attend that give you the emergency medicine practice to go along with it, if you understand what I'm trying to say.
Definitely.
Yeah, because you have a
lot.
Yeah. So that's the difference.
so that's the difference between the acute care nurse practitioner and a family that you saw in an ER setting. But
Mhm.
would you yourself recommend somebody to become and apply for positions for ER nurse practitioner straight out of school? Why and why not?
Straight out of school, I would say a solid no. Um, because I feel like there's different things that as an NP that you need to have under your belt in order for you to be an ER nurse or in your nurse practitioner. I would consider being a nurse practitioner in either settings that you want at least for a couple years. Get yourself familiarized with the treatments, what needs to be done. Definitely put yourself in a position that's very fast paced. I mean, not, nursing home or anything like that, very fast paced. I would suggest urgent care because urgent care are more willing to hire brand new nurse practitioners versus the ER. Because ER, yes, they want you to work in the fast track area, but when they are short, you're going to be in the main ER.
Right.
And then also do a lot of conference because I've done a lot of conference emergency. It's called emergency medicine boot camp. Those are 4 or 5 days of strictly emergency medicine, literally like school from 8 to 6, learning things and get yourself familiarized with the most updated treatment as far as working in the emergency medicine. So that's what I would recommend. But straight out of school, mm,
Probably not.
it's gonna be a little, I won't say no, but it's gonna be a little bit challenging. It's gonna be a little bit challenging.
When you say fast track, I know some places call it actually they call it minor care. So
Yes,
you don't get chest pains, you don't get possible strokes. You get something like sounds more like a flu or a cold,
yes.
or along the lines that's easily treated and discharged from the ER.
Mhm. You're not supposed to get them,
Right.
but sometimes they show up as something simple and then it developed to be that.
Right.
So you also have to be able to differentiate something that is simple as a chest pain from a cough versus a chest pain, that needs to be admitted. So you need to have that knowledge too. Because sometimes they put you all in the ER setting the way it is, your patients are to be assessed first by a nurse. And if something is missed out of that triage assessment right there, it could, it could go either way.
That's
And
right.
it could go either way. And you need to be fast and be able to catch it before it gets worse. Basically.
That's very good advice. Well, you already kind of touched on that. On that, my last question is about your advice how to become an ER nurse practitioner. You said attend conferences. You said try to get like an urgent care. Try to get your feet wet.
Mhm.
As far as get progressing in your career. Anything else that you want to add for somebody who really wants to be an ER nurse practitioner?
Um, Another thing that I found that was very helpful, not for me because I don't have it, but my colleague, they were certified emergency medicine nurse practitioner. That helped a lot. Even just studying for it, even before taking the test, was very helpful because they were a lot more knowledgeable when you speak to them.
Is
You
it
know,
a certification that you get from ANCC?
I don't think it's from ENCC. I think it's from Emergency Medicine Association. I'm not sure. So I'll have to look into that and tell you, but it's not from ENCC. It's separate. It's a certification that you have to do and you just renew it just like your family nurse practitioner. It's a tough test from what I understand. Several of my colleagues have taken it a couple times before they can actually pass it. But the knowledge and the confidence, this is
Mhm.
another thing that they have after going through that class or going through that training, it is amazing. So I would definitely, if you want to be a nurse practitioner in the ER setting and that's what you want to do, that, nothing and nothing else, I would definitely advise to add that knowledge under your belt. That'll definitely help.
Perfect. That is very great advice. Well, I thank you so much for your time. I try to keep these videos short so that people don't lose interest, along the lines while we're talking, but still get the information that they need. So thank you so much for your time today.
Oh,
Have a
no,
good
thank
day.
you. You're welcome. Have a good one.